go to work for you in the morning? Yeah, I'll say, I'm not really here. Thanks, Kian. So anyway, well, until that time, the developments are moving fast and furious. Here to help you navigate how technologies are being connected in the home is Kian Saneii, who knows the entire landscape inside and out. Kian is CEO of Independa, which provides disruptive, next-generation technology solutions to help caregivers help their loved ones stay at home longer, safer, and more comfortably. Welcome, Kian.
The pressure's on. So part of my presentation is really reiterating what we've already heard today. Healthcare is shifting. So when we talk about digital health, where is this shift? It's going from patient to person. Here's my audience participation question. How many of us would love to be patients? Usually I don't get a hand up. So no one really in the right mind would like to be a patient. That's something that we episodically go through in our life, and then we quickly like to become a person and be in our home or our resident. And part of this is the care episode is really transforming to continuity of care. So that's really where you get some of the conversations earlier about analytics, and analytics are all about data. Data is all about how do you aggregate the data and how do you connect the data into a central place. So you can't do that just episodically. If you have the continuity of care, that's very important. We also have heard about reactive to predictive. And I didn't do this slide presentation since the morning. This is a few weeks old at least. But these are general themes that we all agree. Going from sick care fixes to wellness and prevention, from volume to value, and from institution to resident. So the topic for today is how do we have the residents really connected, and what are the technologies that come to play? So this looks like a complex slide, and in a way it is a little bit. But at the end of the day, every one of these areas here, and I'm sorry I can't do both places at the same time, so we'll just do it one. Every one of these is all about connectivity. So you have, in our case, what we do at Independa, as Jill mentioned, we have a platform and a suite of solutions that help the elderly age in place, or basically be where they want to be longer, safer, more comfortably. So typically there's a caregiver involved. So like Dr. McLeary mentioned, in his world, it's really a patient and doctor relationship. In the larger world, there's a patient and doctor, but really for the rest of the day, there's family members and professional caregivers who are managing someone using, in this case, cloud-based system. And every one of these really requires connectivity. So we've heard different technology, and I have my props with me, which are weighing me down. But throughout the presentation, I'll show you a few things. So this is a TelCare glucometer. And we talked about in the morning about how maybe a glucometer might be wireless or Bluetooth. In this case, this is a cellular glucometer. And anywhere you use it, the data gets sent to their cloud, right? And the connectivity is there using a cell chip. And then if you have a daughter, let's say, or a son who is diabetic, that may be all you need, and you can monitor them from a distance using their cloud. On the other hand, if your mom or your grandma is diabetic, chances are they also have multiple other chronic conditions. Chances are they're forgetting to take their meds. So in setting out to build a system to help the elderly, we ended up building really a connectivity platform for their residents, because for the elderly, it has to be absolutely holistic, from reminders to cognitive tools to fun and games to video chat to health, and also safety and activity and environmental sensors. So moving on into this area, so imagine this is the residence of the elderly. So we see a phone there. We shouldn't overlook the simple connectivity to the phone. So there's lots of applications that can be used, either in IVR or in terms of mobile apps, for use on a phone. So we all know about the App Store and the Google Market, but even a standard touch-tone phone is very effective in reminding folks of things, reminding them of medication times, reminding them of calendar events that they otherwise may forget, reminding them of activities of daily living, which they would need to maintain in order to stay independent. So here's just simple connectivity. This area for social engagement, in our case, but really speaking generically, you want to be able to connect with different devices. Not just a tablet, but interestingly, again, to use these props, and this is always fascinating for me, we don't talk about the television set enough. So in the home, what if you can start connecting to applications, health applications and other types of applications in the home or in the residence using your standard remote. What if you're watching Matlock and your grandson comes up with a video chat session? Or what if you're looking at the news and your medication reminder pops up on the screen? And you can use a standard remote to get rid of it. And now you're collecting data. You don't have to have a new device. You don't have to learn anything new. And yet it's all about connectivity into a new device and a new platform. And last but not least here is the picture here should be really a 2Net picture. Today we announced with Qualcomm, who was part of the panel earlier, connectivity with the 2Net platform. So what 2Net does from Qualcomm is actually aggregates a number of various technologies and devices in one place, and they do the burden and heavy lifting of connecting multiple devices into the cloud. Again, it's all about connectivity. So I don't want to skip over this because that's really important as well. What are the connectivity standards in the home outside of health? If grandma gets out of bed 6 hours late, that to me is a health event, not just that her blood pressure is going up a little bit. So when we look at health holistically, not episodically and not based on CMS codes and taxpayer subsidies, we have a much better chance of reducing costs and taking care of the elderly in particular. The good news in this market, by the way, in terms of follow the money, is this is a huge market. Elder care is a huge market. PERS is actually a part of it. Other parts of it, home care, multi-billion-dollar market. Anytime you see an ad for reverse mortgages, that's for the elderly typically, going out and paying for long-term care, typically independent living or assisted living, in the billions and billions of dollars. So it's a huge market, and it's private pay, and it's a real market dynamics. And there was some conversation a little bit earlier about going global. This is not just a US phenomenon. The baby boomers are happening all over the world, Japan, South Korea, Europe, basically anywhere World War II had touched. And you need systems. You need an integrated view and a connected view to be able to take care of folks, to save money as well as to improve their outcomes and lives. So that was the primary slide for the presentation. Now, there's multiple dimensions of connectivity. And this one's not building as fancy as it did on my slide on my computer. But so if you can imagine, let's read these first. Multiple connectivity options. So there's many standards to many pipes to multiple industry solutions leveraged by multiple integration aggregation points. And then you go back and look at, okay, so what are these standards? We have Bluetooth, Bluetooth LE, Wi-Fi, ANT+, Zigbee, Z-Wave, RF. The alarm system devices are all RF. Not all of them, some of them now more are Wi-Fi. But the cost-effective ones, motion sensors, panic buttons, carbon monoxide, fire, you name it, those are all tried and true proven technologies that are in the homes today. And so then you get somehow this information aggregated inside the residence, but then what do you do with it? You have to send it out somewhere else for it to be valuable, unless you want to put a computer in every home. So now you have to get out either cellular, broadband, or plain old telephone system. And so there's another dimension of connectivity is how do you connect the data out of the residence? And different manufacturers have different approaches. But it doesn't end there. So once you get that, there's multiple solutions. So telemonitoring obviously has to solve, pick a choice here and some choice there, get the information out, and do telemonitoring. Telemedicine, the same thing. The difference between obviously telemedicine and telemonitoring being that in one case, it's a doctor's visit that you save and you get paid. In the other case, in some cases, you're getting paid, but in many cases, it's really places like Kaiser and the VA who've used telemonitoring very effectively to reduce costs, but there's no CMS code for it. Home automation is another big area. So, I don't know how many of us have home automation in our homes today, but the evolution of that is not just the audio systems, but now you can do things like manage your air conditioning, manage your outside lights, manage your temperature, and so forth. So even your door locks now. So how important and how critical is that for managing someone's life who's independent and looking to be independent in the absence of having someone maybe be with them all the time? And finally, you get all that data, and so where are the aggregation points? So here's one here, there's many others. Of course, it's our presentation, so we put our name first. But in general, you want to have a point where everything ends up so you can actually make decisions and be able to do thresholds and set alerts. And that's really the value of all this. Again, Dr. McLeary talked about analytics. You can't have analytics unless you do all of these layers and get to the end result and get a lot of meaningful data aggregated in one place, and so you can then have visibility to trends. So of course we have all these different devices. Here's another prop. The pendant from Great Call, this is called 5-star service. And I'm not going to click it here because they do a phenomenal job. Someone comes on the line right here on my phone, or it is a phone, it's a cell service. And they know where I am, so they ask for my name, and they also ask for my location. If those two don't match, they start asking more questions. The value of this alone is phenomenal, right? Particularly for an elderly, but really even for children, for a safety device. It has GPS, it has a bidirectional, very good audio, and it's easy to carry, it's simple. There's no squawk box in the home, and it's really one of the next generations of PERS that I think is simple and powerful and cost effective. You can actually buy it at Walmart, for instance. But the value of connectivity beyond that is, okay, if I'm the elderly person, maybe when I press this button, it's not just good enough to have someone talk to me. Maybe I'd like to have a caregiver also come and play. Maybe one of United Healthcare's nurses should be also tied in to that conversation so they know about it right away. Maybe I want to get reports on this. How often does mom click this button? You want to save money in healthcare, 20% of ER visits for the independent living or for social isolation. People actually are so alone that they call the ambulance and go talk to people in a hospital. So there's a lot of issues that get resolved simply when you have visibility versus isolated solutions. This is a fantastic isolated point solution, which is phenomenal. But if you can connect it to a bigger system with information, you get that much more information and actionable items. I already showed you the TelCare device. A bit of a plug here for Lifecom. That's an upcoming Lifecom device, which is a joint venture between Qualcomm and Hughes Telematics. And different scales, the non-impulse oximeters, Bluetooth, Bluetooth. This could be Wi-Fi, cellular, or Bluetooth. So, and this one's a plain old telephone system connection. In the past, when you think about like digital health, it's interesting. A long time ago, digital health was prevalent and available, but maybe we had to connect it using a floppy disk or even a USB drive to a computer, and that's how we went out. The connectivity portion of digital health is really what makes it very valuable, so that you don't have to do something extra. The data finds its way to the right places. Equally important, again, we don't hear about these sensors in healthcare forums, but these are, in my mind, and I think over time, equally important. In the US, we're a little bit behind than the rest of the world. Europe does a great job really treating overall activity and environmental sensors the same as other types of health devices. Again, if mom has walked around all day and hasn't opened up the fridge because she's cognitively impaired, she forgets to eat. And if I can manage that, if I know that she opens up the fridge, there's a 90% chance she's eaten, but if she hasn't opened up the fridge, I know there's trouble, maybe I want to place a call, or maybe the nurse wants to place a call. What if she left the front door open for greater than an hour? What if she's going to the bathroom suddenly too often? What if she's out of bed 5 times a night and nobody knows because she's living alone? All those are health-related issues that unless you have a central, connected, integrated view, you won't really be able to see the big picture. So these are various health wireless sensors, again, commodities practically, but now being brought in to the healthcare discussion, in our case particularly for elder care management. So this platform, by the way, doesn't have to be for elder care management, right? It could be for any type of health monitoring from a distance that you want to have and need to have a holistic view. For example, we talk about supported independence. So what if you're having stroke recovery, or you're managing autism spectrum, or you're managing Down syndrome? There's so many different areas where for months and months, sometimes years, someone may need supported independence. And the cost of that and the anguish involved on them and their family members in the system is all pointing towards having a way to centrally manage this from a distance and really address only the exceptions and when triggers are met versus all the time trying to do it through brute force. So in this case, just again, to talk about abstracting the hardware, so there's multiple health devices, of course. There's multiple types of home sensors, so these are pictures we saw. There's multiple protocols, and then there's multiple aggregators. And in this case, for instance, Ideal Life would be a telemedicine application with a hardware, FDA-approved hardware, but outside of telemedicine that could be leveraged to provide continuity of care. So in closing, Connectivity is the key. Digital health is fantastic, but unless you can get those digits all in one place and out of the residence, it's really not fully leveraged. Home is really the residence. So when we talk about in the home, I took the liberty really in particular for the elderly, home is where they live, and oftentimes it could be independent living or assisted living facilities. And there's no reason why someone who's just as lonely and isolated in an assisted living facility can't use this technology. And there's no reason why United or Humana or WellPoint or anyone else, Aetna, wouldn't be just as interested in reducing their cost by improving their visibility in a residence. I'll give you an anecdote on this. One of our partners, the care manager, had gone into a home, and at the end of the hall, it was a residence, at the end of the hall was this lady, and she goes in and notices a TV, which is really one of the primary tools that everyone uses in those facilities, was blasting, and she goes, oh, I see you love to watch TV. And she goes, well, no, I don't watch TV, I actually watch the door. And the care manager says, you watch the door, why do you watch the door? She goes, well, I watch the door because I'm last in the hallway, and if there's a shadow, I know it must be my daughter. So those are the lives that are costing the system, as well as the anguish around the family members and everyone else. And what if you can actually give social connectivity to that person? Again, it's connectivity through video chat, through Facebook, through email, in a holistic way. So it's really the residence, not just the home. And the hub is not the resident, but the resident. Everything I've talked about is really about the person. So it's not about where they live. It's about, ultimately, Qualcomm's working on technologies, body patches, and there's pills that send information out. There's no difference. You want to be able to collect that information and centrally leverage it. So complexity in all this is the pain. So the previous chart and some of the things I showed, it's all about the complexity. There's multiple standards. The wonderful thing about standards is that there's so many of them, right? So there's manufacturers that pick one or the other. They don't necessarily interoperate. Some of them are more difficult. At the end of the day, it's very complex to make sense of that. But the integration of those devices and that data is the antidote to the complexity. So sitting at a layer above, like we do on the software side, or like Qualcomm does in the aggregation of the data and the hardware, is critical. And aggregation of all this is the future. So to be able to get new patterns and reduce costs and see benefits in a big way, you want to aggregate the data so you can do predictive analytics. So I have time for questions. Okay, great.
Anyone have a question? Oh, there we go. So you were talking about aggregating the data. So in one of your earlier slides, you had EHR and CRM and the enterprise cloud.
Hello, hot mic, okay. So you had the enterprise cloud coming in. Do you also have your aggregated data going back out to the enterprise cloud? And sort of how does that interoperability work?
We have it on medications at this point, but that's a very difficult problem to solve. For instance, if you're working with Epic, Epic allows you to get information out, but not put information back in. So there's some practical constraints around sort of the silos of HIT, but really the vision, not just about Independa, but the vision is if you use this platform, for instance, for a hospital discharge, right, or transition care management, there's no reason why somebody who's leaving a hospital can't be given a tablet and go home, and all their new meds, all the new conditions, everything else are monitored for them automatically, because the system already knows what they were in there for and what they left for. So that's really where the connectivity outside the home, I didn't emphasize it because it's outside the home, but that data does get leveraged back into the home once there's connectivity there.
More questions? I guess you answered everything.
Great. We have extra time.
Thank you.
I'm not going to leave.